Welcome to the channel. It's Dr. Durst. If you are new here, I am a traditionally trained physician that specializes in regenerative medicine, so non-traditional options that don't involve medications and surgery, but I do have a focus on sexual medicine, also non-traditional options without involving surgery or medicines. So what I want to encourage everyone to do is, if you're new and you like the material that I'm putting out, please like and subscribe. It really helps the channel and get the information out there to people that might be looking for it. Today, this one's for women. So in my practice on a daily basis, we hear over and over again, are these symptoms that I'm having related to my hormones because I'm told that my hormones are normal, or my doctor didn't check my hormones, or I'm too young, I don't have to have my hormones checked. So what I wanted to talk about was perimenopause. There's lots of questions about exactly what that means. So perimenopause, I always say, is that time frame between 40 and 55. Technically it's 40 to 50, but it can be 40 to 55 because the average age of menopause is 51. So in perimenopause, your hormones start dropping, and typically we're talking about testosterone and progesterone. And when your estrogen drops or you stop making it altogether, that's menopause. So this is the period of time prior to menopause, and it can vary in a time frame. So age 40 to 55, and it could be anywhere from 4 to 10 years. So in average, about 10 years if you have some symptoms such as brain fog, low energy, sleep disturbances, hot flashes, night sweats, mood disturbances, you're getting more anxious, you're getting worked up over things that you never used to get worked up over, you're feeling depressed. And again, gaining weight is a huge one with body composition changes and low sex drive. All of those can be related to hormonal fluctuations that start happening during perimenopause. And that it just means that sometimes your estrogen will be up, sometimes it's down. The progesterone and testosterone are not being produced like they used to, and they're not balancing estrogen. So estrogen doesn't go up, it's still fluctuating and all over the place, but it's not being balanced by those other hormones. And so that's why you're experiencing symptoms. So the number one step is to have your hormones checked. And if your doctor isn't checking them or isn't providing you with some solutions, then you need to see a hormone specialist that can do that. So they can test your hormones, which again, if you're having periods, then you're not menopausal. You have to go greater than a year without periods for them to consider you menopausal. But a lot of women will have some severe symptoms and it's not quite a year since their last period. And some will have no period for a while, but they're still producing a low level of estrogen. So the important thing is to have your hormones checked so that then you know if you're menopausal or not, and if your hormones need to be optimized and your symptoms therefore controlled. So I would love to hear some feedback about what you're being told. Have you asked your doctor? Do you feel abnormal? Are you not feeling like yourself? Are you anxious and worked up over things that you never used to, doing all the same things and gaining weight, not sleeping, no sex drive? There's all kinds of different things, but those symptoms should not be minimized, and you need to get some answers. And so women are progressive in this area, and they search for answers, and they're looking for providers with the knowledge and solutions. So please let me know your input, and I hope you like everything that we're putting out. And if you do, please subscribe, share with friends. I'm willing to deep dive into anything wellness or sexual wellness.